can you tell me more about Roche Diagnostic Indonesia business in Indonesia?
Sure, thank you very much. Well, Roche, it's been operating within Indonesia for over the last 50 years already, right? And we are one of the leading healthcare IVD providers. We have actually installations of more than 2,300 instruments across Indonesia. And last year, more than 50 million tests for Indonesian patients has been ran using Roche instruments and reagents. So we are very much one of the market leaders within Indonesia.
Okay, so how is Roche Diagnostic Indonesia leveraging technology to improve the speed and accuracy of disease diagnosis for the patients?
Well, first of all, if I were to break up your question a little bit, right? So in terms of technological innovations, what does it actually mean, right? If I may just break this down into three different types of diagnostics technology innovation. The first is around automation, it's around robotics, it's around improving operation efficiency and productivity of laboratories. So how can we ensure that the blood samples or the patient samples, when it's delivered to the lab, gets reported, that the results get analyzed and the results get reported in a quick turnaround time such that the doctors can receive these results and make the rightful treatment decisions for patients. So in terms of innovation in this area, we have automation that actually replaces a lot of this human manual work, and this also improves the accuracy and the quality of the testing, right, such that we reduce human error as well. And then there's the second bucket when we look at the technological innovations, and where I'm talking about medical science advancement, right? For example, discovering new tests, or new molecules that should be tested when trying to do analysis or try to make a diagnosis for a patient. An example could also be with the using a biomarker called NT-proBNP, which is basically helpful in trying to stratify the risk of developing heart failure in type 2 diabetic patients. So this is new innovations that, and claims that, medical claims that we are actually also providing and advocating. And of course, the last bucket, you would have guessed, with regards to technological innovation would be in the world of digitalization, right? So I think this is definitely the next breakthrough, and digitalization also will be looking at how do we digitalize medical records, having accessibility to patient data, as well as freely flowing of management of data, storage of data. And on the other hand, we're also looking at about how can we utilize, say, artificial intelligence, AI, right, to help clinicians, help doctors, healthcare workers make better decisions and providing better treatment for patients.
Okay, talking about digitalization, what role do you think artificial intelligence play in improving diagnostic accuracy and accelerating disease detection in Indonesia?
Well, the truth is this. First of all, we have a shortage of healthcare professionals globally, right? And especially in Indonesia, I believe this number is even more critical, right? Around the world, the average is about 1.7 doctors per 1,000 population. In Indonesia, that number drops to 0.7, right? So we do have a huge shortage of healthcare professionals, of doctors, taking care of the 280 million population of Indonesians, right? And so the doctors are super busy. They do not necessarily have all the bandwidth to...
Don't have much time.
Yes, exactly. And therefore, if some of these processes, right, can be taken care of by an AI automation that could help alleviate the workload of healthcare professionals a lot. And the doctors could then focus their time and energy on the patients that really, really need their attention. I give an example of a AI algorithm that we actually provide, right? So the context is this, right? For cancer patients, they would need to have a tissue segment taken from their tumor cells and then provided with a stain and look under a microscope for diagnosis of cancer. And when the doctors, or in this case a pathologist, would need to actually count how many cancer cells based on the color change. Yeah. Exactly, it takes a lot of time and to read each slide through a microscope. And if this process, we actually now have a solution that allows this to be digitalized, right? The image of the color stain, right, is taken on a camera, stored on a server, viewed through the screen, and then the AI algorithm actually already highlights the color change, and this saves a lot of time and increases the productivity of the pathologist a lot. Yeah.
Okay, so what specific diagnostic innovations have been introduced to reduce the need for Indonesian patients to seek medical care abroad for now?
Okay. So when we look at seeking care abroad, right, medical care abroad, I would like to believe that the main driver for these patients going overseas for medical attention primarily are driven by the belief that they are going to get better care in terms of the speed and also in terms of the quality of healthcare, right? Because we may be thinking that certain technologies are available overseas rather than within Indonesia, a healthcare ecosystem.
Also about the services, I think.
Also the services, right? And of course, the long queuing time in many public hospitals, right? So to get the best care, right, they believe that there is a need to actually go overseas. So again, I think in this day and age where, first of all, digitalization is very much more advanced, right? Telemedicine is, of course, an option, and also sending of patient records remotely, right? Improved accessibility is another way to actually keep the patients within Indonesia, right? And last but not least, in terms of the quality and the accuracy of testing results, this very much would already be available within Indonesia.